All of you can hear me?
Yes, we can hear you.
Now the quality?
Time is better.
Yeah, that's good.
Okay. So coming to the sitting posture, keep your back, neck straight, align. Bring the awareness towards your physical body and gently close your eyes and take a deep, prolonged, slow inhalation. Take prolonged, slow exhalation. Now inhale for the 3-time Om along with Shanti. Take a deep breath. Om. 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 Shanti. Shanti. Feel the vibration in it. Join your both palms. Grab your palms. Place on your eyes. Feel the warmth. Very slowly while blinking, looking at your palm. Gently open up your eyes and say Om Shanti. So welcome to the therapy class. And in previous session, we discussed about the arthritis, the diet for the arthritis, and we talked about what kind of food they should take it, especially for the arthritis. They shouldn't yogurt and milk, cow, basic cow milk, they can have it, but yogurt and everything which is prepared with the yogurt and all taste of sour, they should strictly avoid that taste, okay, sourness or fragmented food, because these kind of things, vinegar, completely avoided by the when they are having the arthritis. And then further, what we can give the quick relief for them. They daily have to take the sun bath, morning time and evening time. So morning time is like when sun is about to rise, that time, and evening when sun is about to set, that time, 30 minutes. And when they are taking the sun bath, they can have the massage. So abhyanga is very much important. Massage means abhyanga. We in Ayurveda we call abhyanga. Abhyanga here upward. It's like using the oil. What kind of oil? So mustard oil, almond oil, sesame oil, and even the ghee, cow basic ghee can be used for the abhyanga. So warm, uh, take the warm, oil and place upward towards your heart. Very simple, not too much pressure you are giving to your body. deep tissue massage not given to them. Okay, so they can do these massage daily before taking the bath, and they have to lie down on the sun. And how they have to take the sun bath? Make sure naked is best, but if you're living in Indian continent, that should not be acceptable. So white cotton clothes from the top to the bottom, one piece they can wear, and then they can do the massage. Okay, they cover the major part of their body, and by doing the massage, after that they can rest. And while taking the rest, they can do the little bit breathing. So abdominal breathing and thoracic breathing, very good after the massage. Okay, and then after 30 to 45 minutes they can go for the bath, and bath should be given with lukewarm salt water. Bath should be given to them, so they have to put the salt into the lukewarm water and then they have to take the bath. Okay, afterward, whenever they have the attack of the pain, that time ajwain potli massage is very good for them. So ajwain is a kind of spices. I have given the name in yesterday class also. 𝐴𝐽𝐴𝐻𝐴𝐻𝐴𝐼𝑛, ajwain. So that ajwain uh, use the potli. Potli is like cotton, a piece of cotton cloth. Put the spices in like 250 grams and then heat it. Use the pan and then the iron pan. Okay, iron pan. Use it and then keep that potli. We call it potli, the bundle kind of bundle thing, and then heat it. And even after the massage, you can do the potli massage on your inflammation where you're having on your fingers, in your elbow, whatever you feel pain, even in the neck, where you feel the stiffness, that you can give that potli massage. Ajwain potli massage can be given to them. So these things instantly give them, the relaxation. Then in food, ripened banana, ripened mango should be given to them. And I talked about it, the pineapple, chiku, they can have it, but not unripened one. Okay, kacha nahi khayenge. They cannot have the raw one. By adding the ginger powder and the rock salt and cumin on the top. Then these things and make sure they don't sleep in the noon time. Um,
I think you were muted. Ah, you're back. You're back.
yeah. Okay. So you heard about it, right? That they take, the bath, the lukewarm bath, and after that, the potli massage would be given to them. And then make sure they are not sleeping during the noontime, during the daytime. Evening time should be after the night, like 9 o'clock. After that, they have to go to the bed. After 9, don't late night they are going for the sleep. So no matter they are falling into the sleep or not, but make sure these people that they have to go 9 o'clock on the bed and make sure they are not having the stomach full, empty stomach, they have to go to the bed. Okay. If still they feel, so before going to bed, 30 to 40 minutes, they can have the milk. Okay, little milk cow, they think cow, happy cow milk, they can have it. But it's very difficult to find the cow, milk, happy cow local milk. So almond milk, which is homely prepared, they can have it. Okay, by adding the pinch of turmeric, ginger powder, raw ginger powder, and then black pepper, and they can have with the piece of the jaggery. Okay, and then they go for the sleep. So these are the diet for the arthritis. Okay. Now, um, um, even for the osteoporosis, in osteoporosis condition, the diet is similar. The only one thing they can have the yogurt also. There's the only difference that in osteoporosis your bones are becoming weak because of the age, due to the age and your poor lifestyle, because of the lack of the calcium and vitamin D also. So bones are not strong enough, it's become thin. And because of that, anytime, even you cannot figure out, they look normally healthy. But when there is some kind of activity happen, they just slightly slip. They get the fracture, and that time, doctor figure out they have the problems of osteoporosis. So in this condition, diet would be same. Only they can have the yogurt, the other things of like charch, buttermilk they can have, lassi they can have, but arthritis they strictly boycott these things. And the yogurt part. Okay, rest of the diet would be similar to the all kind of bone related problems. You have bone inflammation, even cancer, osteocancer if you are having it. Um, then also you are having the same diet. Okay, all the problems which is related to the bone, strictly they have followed this diet. Even if you have the back related problems, uh, you can have everything. The cow ghee, cow milk, and cow yogurt is very good for the in the back problems and the osteoporosis, right? This thing only change for them. Now come to the acid. So three problems: arthritis, osteoporosis, back related issues, same diet except yogurt part. Okay, yogurt made products they can have, but don't go for the frozen yogurt. That is not good. Ice, anything which is too much cold should not be given to anybody. Even if you are healthy, don't take it. Ice cream, Ayurveda doesn't talk about that. You should go for the enjoy the ice cream. Okay, so you have to stop taking it. But yes, if you really want, you have very but not for these people. They have the problem. Even though they have the craving of it, they cannot have it. But if you're healthy, you can take the risk. Okay. So these things you have to consider. Now come to the asan. What kind of asan is good for the arthritis patient and osteoporosis also? Okay. Bones are weak and fragile. So they cannot do the standard practice, whatever you are learning in this session, and vinyasa and the other forms of the yoga, or the Bikram yoga or other varieties of the yoga practice. Simple, subtle movement of the practice that called sushmyam. I'll write for you. Sushmyam they can practice. So it's called Pavan Mukh series also. Pavan Mukh Asan. Okay. Or Sushma Vayama. Okay. Sushma Vayama. So in this Pavan Mukh series and Sushmayama name is same. Subtle movement of the body is like rotating your neck. Okay, this movement and sidewise. Okay, wrist movement, then your finger movement, because Anguli Shakti, the name is Viva Shakti Vikasa Kriya. Don't worry about the name, okay? I'm just giving you the idea about it. Then rotation, Griva Chakra, okay? That you can do. Then Mani Banshakti Vikasa, we call Sanskrit name Mani to the wrist. Then Angli Shakti Vikasa Kriya. These are the Sanskrit name of the asana. But don't worry about the name. If you forget about that, it's okay. But any movement of these, like Kohni Shakti Vikasa Kriya, then Purnbhuja Shakti Vikasa Kriya, these should be given to them. Then your back, okay, then your knee movements, then your ankle movements, then your dorsal and plantar flexion up and down with your ankle movement, right? Every joint should be, all the movements of your synovial joint should be practiced by um, all the patients, those who are suffering from the bone related problems. Okay, even these simple practice can be done by this. Gonna work on your prana shakti. It's gonna release all the pran vayu which is stuck in your channels, nadis, and then you would be feel more energetic, and you are improving your joint function. Okay, and your whole body, simple practice, simple stretching should be given to them. So in asana, at least 45 minutes they should practice morning and evening. So morning before breakfast and evening before whatever they going for the milk or something. It means your stomach should be empty. Okay, you should be having the stomach fully empty. It's like 4 to 5 hours your stomach would not be having anything. But yes, water if you're taking, that's okay, but not eating, not solid should be given to your system. Then come to the breathing practice. What the breathing practice should be, prescribed to the even back related problems. Okay, yeah, add one more thing: osteoporosis, arthritis, all types of arthritis. Okay, rheumatoid arthritis,
You're back.
okay.
Yeah.
So all the asana, all the cobra pose, all the variation of the cobra pose is very good for their upper back related problems and lower back related problems. Okay, but make sure you keep your feet apart. It should not be joining. When you join your feet up, closer, it gives tremendous pressure. So try to reduce the pressure when you're keeping the feet at the distance. So variation you can implement and check the pressure of your back. It should not be giving too much pressure to your back muscles. Okay. Then other asanas you can give it to them. Pavan Mukta asana, which you bringing the leg crosser, like lying down on your back, and then bringing your leg to closer to your chest, and then you're hugging your knee, right? That asana also very good for your back related issues. Then Markat asana, all the variation of the Markat asana. So you can Google the Google later on Markat asana. So it's called Markat asana is like when you're twisting your back. Okay, all the twisting asana of your back is very good for the back related issues. Okay, Forward bending should be prohibited to them. Don't go for the forward bending. But any movement which you're raising your leg towards your upper torso, it could be good. But you cannot bring your chest closer to the leg, like inversion or semi-inversion, forward bending posture, completely prohibited to them. Okay, but leg you can raise it, lying down on your mat in the supine position and raising your leg at the 90 angle, that you can do. Then only that one, okay, not other one. Halasana you cannot practice, okay. Sarvangasana again give you the pressure on your spine structure. Spine is very weak. These things no. Simple posture, up and down with your leg. Um, Tadasana is very good for them also. These simple asanas should be introduced for the back related issues also. But make sure variation of the Bhujangasana is very good. Dhanurasana is very good. Then boat pose, uh, again the simple version of the boat pose. And the Superman posture is also good. All the twisting posture is very good for the back related issues. Okay. Then come to the breathing practice. So safe breathing practice, we're gonna talk about it. So especially for all the people who are having the bone related issues, they should practice the breathing more. Okay, because they have the problem in the bone. Remember Saptadhatu when I talked about it? Remember? Ras, Rakt, Ma- Ras, Rakt, Mas, Med, Asti, Majja, and Shukranu. The next last is Dhatu. The seven, you know, tissues which is made of the food. Asti is, also made by the food. So very much important that food should be, given properly to them. And also the prana vayu play very important. Is another kind of food for your body. Okay, so prana vayu should be given properly to them, and it's happened because pran ama is generated in your body more, and then it starts reaching to your bone tissues, and then you get the bone related problems. So diet, we take care of it. Then now we have to understand that pran would be increased by the breathing practice. So abdominal breathing should be introduced to them correctly. First, you have to correct their breathing pattern, and it can be happen with the abdominal breathing. Abdominal breathing, then thoracic breathing, and then yogic breathing. So 15 minutes, 15 minutes abdominal breathing, 15 minutes thoracic breathing, and 15 minutes yogic breathing, and then you're gonna end your breathing with the Nadi Shodhan. 15 minutes Nadi Shodhan. At least 1 hour, 1 hour, minimum 1 hour, they should practice the breathing. And even remaining in the asana posture, they can, when they are holding the posture, they can go for the abdominal or thoracic breathing. Before having any meal, they have to practice the um, abdominal breathing. Okay, so breathing play very important role in order to cure these issues. Then 15 at least 1 hour maximum you can, if you do it's very quickly you're gonna heal. Whole day you have to, you don't have many options. First thing, you don't have option, and then you cannot complain about, oh, I don't have much time. You have to take out the time for your body. Otherwise body becomes so weak, then you're gonna take the bed forever, and then you lying on the bed forever. So you don't have option. You have to take out the time for yourself. That's you have to understand, especially for the yoga therapy routine. It's not for the people who say that I don't have time for myself. Then we cannot help them. Okay. Then this therapy would not work for them. It's not 10 minutes, 5 minutes. Okay. By running, you can do these practice. No. You have to sit back, relax, and then take out the 2 hour morning time or 1 hour evening time, at least 3 hours. Give time to your body and practice. And then these breathing, I guarantee that eventually it will take time, 4 months, minimum 4 months, okay, minimum 4 months it will take to change your habit, to change your tissues, to change your body function. And you're gonna see that eventually you're gonna come out from your issues. So breathing, again, more you have to do. And before having the meal, 15 minutes, they can go for the abdominal breathing also. Okay. Then um, you can also, allow to give them the meditation. Meditation plays very important role. So what kind of meditation they can go for it? So it's a mostly Vata related problem, and Vata people cannot sit or with closing eyes. They require the object. So Brahmari pranayam you can introduce to them. Okay, Brahmari pranayam. Start even chanting, which I talked about it. Chanting you can use for the meditation, or like Gayatri mantra or the Loka Samasta Sukhina Bhavantu, which we discussed in the meditation class also. Anapan should not be given in initial stage, though it's very good for them also, but there's high chance that their mind would not be able to grab that technique. So, where active kind of meditation should be given to them, like where their senses are engaged. So, listening meditation, dancing meditation, you can introduce to them, or Brahmari pranayam you can use for the meditation. So you can end your routine with the Brahmari pranayam. So how long? At least 30 minutes they have to practice, but it's not continue. Take the break in between and then again start morning and evening time, again 1 hour, or any time whenever you're waiting for somebody, whenever you get. People are doing so many things when they have plenty of time. But when it's come to their body, they say, oh, what other people gonna think? You are dying. What other people gonna think? Let them think. So whenever you get the time, just start practicing your breathing. Just start doing your meditation. Don't waste your time to doing other things. Whenever you get time, whenever you're traveling in the bus or any car, you are in the back seat, not driving, okay, in the back seat. That time you have time. Start your breathing. More you do the practice, more you're gonna quickly gonna heal yourself. You gonna heal yourself. Yoga therapy is just gonna be showing you the guidance, giving you the guidance. Rest of the thing, the patient should have to practice it. Okay. So here, patients require strong determination. Okay. So this is all about the therapy for the bone related problems. So no matter back related issues, so then you can give it in the certain back related muscles, how you can activate through the prone position and the supine position. Okay. And then these asana can and twisting poses you can introduce. Then all the Sushmayam and Pavan series asana. You can, all the subtle movements, these movements, okay, is very good for strengthening your bones. So these asanas and these practice should be given to them. Uh, now, most important thing that don't forget to give them the sun bath. They have to go for the sun bath morning and evening time daily. Okay, they cannot skip. And they have to be, now we can include the color therapy also. So color therapy, white colors should they have to wear a lot. So not dark color, okay, gray and all the shade of the gray and the black should be completely avoided. White and white background clothes is preferable for them. Okay, these colors would be good for them. Then they can also have, they can drink the sun water also. So you require the glass, a big glass bottle, fill the water, the RO water, and keep into the sunlight whole day. And then when sun is set, drink that water. That's also help them to increase their pranic energy, and it's going to implement for everyone, especially not for only pitta. In pitta condition, we should not giving these the sun water, but vat and kapha, yes, they can have the sun water. So this is the whole general treatment for the all kind of bone related issues. Any doubt, any difficulty? Question answer time.
Thank you. It's okay.
Okay. Everything is clear to you that how we're gonna, set the routine, and even in your family, somebody is facing these problems, these gonna help them a lot. Even if they are taking the medicine, allopathic medicine, you can, along with the allopathic medicine, you can, continue this therapy also. And then gonna quickly, they can heal automatically by themselves. Okay. So no questions. So we're gonna end the session here with
Can I
chanting
just
three
ask
times.
one? Can I just ask one quick question? If a person is mixed dosha and some of these foods and everything might be contradicting one particular dosha, but they're good for the other dosha, how do you know which one to have? And also the other part of the question, I suppose, is like how to determine which dosha is dominant, because are there symptoms determined by the mental state or the physical state? So two questions, sorry.
So both you have to consider, understand. For that you require the Ayurvedic doctor, and for that you require the therapist. Because sometimes you can easily figure out the one type of dosha, but another dosha is which is also dominant and in the combination personality is very difficult to find out. So that's why you required me, okay, or you required if nearby you have the therapist or the Ayurvedic doctor, you can take the guidance of them, and because it's quite very deeper understanding of the personalities. Okay. But what we can do about, if that's why I have given you the safest therapy. This can be implemented for the all the general issues of the arthritis. If somebody is having the symptoms of the arthritis, it means it should be given to them. And I skip those parts which is individually I'm gonna include, or the doctor gonna include. So this is the safe practice. Only the yogurt part which I included, yogurt part or all the sour things should not be given to whenever you have bone inflammation or bone related problems. Okay, in that condition, strictly avoid all the all the things which is made of the yogurt. Okay, that you have to consider. That's also I pointed out, but rest of the things is safe. You can prescribe to anyone. Okay, I excluded already that which is the which you require the deeper understanding of that thing. Clear? Dear?
Yeah, with the arthritis and these bone related issues, that makes sense. But how
Yes.
about just generally, if a person is mixed dosha, then how will they know which foods to avoid? Because some of the foods might be on the okay list for one dosha, then they'll be on the avoid list for another dosha. So
Oh, have you missed the previous classes? Because I talked about in Mitahar according to the three dosha, the diet. So symptom wise, whenever you have the symptoms, I keep telling the symptoms is showing that you feel the heat in your body. That time it means pit is increasing your body. So that time you have to take that day. Even I talked about for that day you have to see previous video. I talked about when season is changing, your body is also changing. During that time, you have specific symptoms in your body. If you're having the pit increase, like so you start feeling the heat during the summertime. in that time, you have to specify, I have given the Pitta diet. Then when there's a cold season, winter season, then your body start having the kapha. Season is also affecting your tridosha. Kapha. That time you have to have the kapha diet. Even mix matching, so moderate diet, I have also talked about it. So I talked about everything in the Mitahar session. I think 1 week we just talked about the diet of everybody, three dosha diets and combination diets also, and the general diet also. I talked about it. That generally, according to the position of the sun, that is a general diet. If you're confused about it, what should I go for it, and when to eat it, then follow the general diet. I also talked about that thing.
Yeah, I was there for that one, I think. So it makes sense. If
Ah,
there's
hmm.
heat, then obviously eat for pitta. So eating it against opposite of what's happening. I suppose
Exactly.
with the particular foods, maybe just trust the body then, or see a someone specialized. Because if bananas are good for
Yes.
one, if they're good for vata, for
Yes.
example, and then they're bad for pit, but then if a person is vata pit combination, then and they're dominant in both 50-50, so then maybe just don't
Hmm.
have the bananas then or something. I don't know. Is
No, you
that
can have the banana. You can
oh
have the banana. It's good for the pit also and bath also. Kapha people cannot have the banana. So for that, what I should take it, what I should not take it. Don't make yourself so complicated. Okay,
okay,
it's
okay.
so much deeper understanding you required, because every food have the quality, and according to that you require deeper. Like for it, I told you, pit and vat both can have banana, but kapha cannot have banana. So every
Oh,
food you have to know about it, but then you get confused and it's required deeper understanding. So that's and I just told you the safe version. When symptoms show you that you feel the heat specific day or maybe specific time, that time just change your diet, okay? And then when you feel okay, then eat according to that. So symptom wise you can follow also, and your body always give you the signal, always gonna tell you that by eating it, your stomach make the sound. Okay, your stomach
yeah,
gonna make the sound. If you eat
yeah,
the banana, you feel bloating immediately. So it means banana is not good for you. If
yeah.
you have, ginger tea, and ginger tea after that you feel the burning sensation, so it means it doesn't for you. So try to shift your attention towards your body. Your body gonna tell you everything. Okay, everything,
Yeah,
all the things is here. You don't require
because like
anybody. Okay.
yeah, because with females, the body and the hormones, it changes every month. So the body requirements are
Exactly.
different week to week for a woman,
Yeah.
you know. So
Exactly. Exactly.
yeah,
You got it. But anytime if you have any doubt in that thing, just follow the general diet, sun, food according to the sun, and one major dosha which you figure out by then, and try to do the experiment with it. Okay.
okay,
So even if you have some closer doctor, you can go take help of those people also. Okay.
okay. Thank you so much.
Uh, So let's end the session with the one time Om and Shanti Shanti. Deeply close, gently close your eyes. Take a deep breath. Om. Shanti. 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 Join your both palms. Wrap your palms. Place on your eyes. Very slowly, gently open up your eyes and stay on Shanti. Bye bye. Take care. Bless you. Enjoy your weekend and meet you at meditation class. Om Shanti.
Thank
Bye
you.
bye.
Thank
Thank
you.
you.